I'm Tammy Bashirs, and I'm the school nurse for Chester County Middle School and Westchester Elementary. First off, let me start by saying that we are so excited to get started. We are ready to have the kids back in school, and we are just setting on go. One thing that I want to address this year is communication. Communication this year is going to be very, very vital. This is a year unlike any other year that we've had. So communication between the school nurse and the parents, or the principals and assistant principals and the parents, is very, very vital. So I ask that you please at all times keep a working number available so that you can be reached. I know sometimes that people have to get different phones throughout the year, have numbers changed and stuff like that, but it's very, very important that we keep that line of communication open this year, since there are some new changes in our school that may require us having to contact you. It's important. Also, if your child is not feeling well, if they're not going to be at school, please let us know. We have to mark that and keep up with absentees and reasons why. So that's a reason for an open communication. And also, if your child has a health issue that we need to be made aware of, please let me know. You can call me at the school, you can email me, and any way you want to use, we can do that. But communication is a main priority for this school year. One of the main things that we're doing this year that is different from the years past is the temperature change. In the years past, we have used 100.4 as the guideline for sending students home. We are working very closely with our regional health department nurse, the Tennessee Department of Health, the Tennessee Department of School Nurses Association, and many other resources to help us set our guidelines and rules to go by this year. And changing the temperature was one of those recommendations that was made. This year, the temperature that a student has to go home at is 100 or above. If your student comes up complaining and not feeling well, someone will check their temperature. If it is above 100, we will have them to sit and rest for approximately about 10 minutes, and then we will have a different person to check that temperature. If it is still above 100, we will notify the parent that the child needs to be picked up. If the parent is not available, we will go down the list. I ask you to please, on that list, make sure that there is someone that is available at all times that can pick your student up. I know this is a big change. I know that it is things that may not be well liked, but this is a different type of school year, and with that comes changes. We will not be allowed to give your student Tylenol and let them sit and send them back to class. It is strictly a policy that a temp of above 100, after check twice, will have to be picked up by the parent or someone on your list. Also, if you have a student that takes a prescription medication, we are, as in the years past, we still need the prescription medication form filled out. It needs to be signed by the physician, and it needs to be signed by the parent. We need these as soon as possible when the school starts. If this is a medication that the students are going to be taking at school, we need to try to get this as soon as possible, as we're really not supposed to give the medicine until this is in. So if you're seeing this and since school's not started, I encourage you to go ahead. You can download this off of our website and go ahead and have this filled out and ready when school starts and you bring your medication. There's also a non-prescription medication form. This form, though, however, remember, cannot be used for a temperature over 100. Should your student come in, though, with an earache or a headache or leg aches or something like that, or have had some dental work or something like that done, and they require Tylenol, we can give for that reason. But do not send Tylenol in if you are planning to give it for a fever, as we will not be allowed to do that this year.